I always had a little bit of a gap in my teeth, which I didn't mind. I was used to it. It was me. But as the front teeth were drifting away from each other, that gap was getting bigger, and I was smiling with my mouth shut. My dentist made me what's called a partial denture along the top here for those teeth that were missing. And everything went well for a number of years. I was quite strict about having my teeth cleaned 4 times a year, not missing any checkup appointments, getting everything attended to that I needed to. But as you get older and you've had gum disease, you suffer from bone loss, your gums shrink, the partial was becoming loose. I was a teacher. My voice was very important to me because when you're a teacher, your voice is one of your secret powers, I guess. And a loose denture doesn't help with your speaking.
Anne was a very nervous patient. She was the type of patient who was trying to avoid seeing the dentist. She would only see them very minimally. And I guess the one instigating factor was that her denture would fall out. And she had a denture that ran halfway between the midline to the back, and she ended up having a problem losing one of the teeth that was anchoring that denture. And now every time she would talk or eat in public, it would just drop down, and that was driving her nuts.
I was starting to have to use dental paste in it, which is vile, gunky stuff. I was putting it in the morning after I brushed my teeth. I was having to brush my teeth after lunch, put it in again. And I hung on for maybe another couple of years, and again dealing with this horrible partial denture that was loose. Steak was out of the question. I was cutting the corn off the cob. I was eating a burger with a knife and fork, which some people thought it was sort of a polite English thing, didn't really say anything. But it's because I was afraid to bite into things with any confidence that I wouldn't be left with a tooth.
So we've staged her and said, okay, we can accomplish what your desires are in terms of your smile. Send me a few photos when you were younger and try to reproduce either a smile that you've had in the past or a smile that you've never had. And she chose to go with something close to what she's had in the past. And that's sort of where we started designing her smile. We restored her with a few implants on the upper right. She still has her original teeth on the upper left. And on the lower, we're still working with her on that.
The first time that I saw my mouth with the crowns on and no partial denture, I was lying back he might have sat me up in a dental chair, and I was shown the mirror. Dr. Reyes had asked me, do you want to close that gap? We can close that gap. And I said, no, the little gap is kind of me. But he made it way smaller, and I was very happy. Huge smile when I saw it. It felt good. But you know what else felt good? Not just the appearance. It was the other things. I went home that night and I said, I better not have a steak tonight because they just come in. But I had one that week and I could bite into it. I could bite into corn on the cob. And that felt amazing. I could eat a burger, not with a knife and fork, but bite into one. The feel of it was good. Not having to take that horrible denture out and put it in a solution every night in the bathroom and put it back in the morning. The freedom of it. You know, when I go out to Vancouver and see my grandchildren, do they want to see those teeth in the bathroom in the morning? No, it's scary. These are Granny Annie's teeth here. What are they doing here? I felt free of that.